In this video, we will look at some examples of atrial electrical activities or the origin of supraventricular impulses. Let us look at a normal electrocardiogram. Here I am showing the lead 2. Here you see this is the baseline, this is the P wave, this is the QRS complex, and this is the T wave. We will start with only the atrial activity. This is the baseline, this is the P wave. Here the P wave represents atrial depolarization. Though we call it sinus beat, in this case it is based on the morphology of the P wave. In this particular lead, upright position point to sinus origin. Please remember, SA nodal electrical discharges are so minimal and not recorded in an EKG. The resultant atrial depolarization is the one shown in the EKG as P wave. With the atrial depolarization, now the atrium is contracting. Question: do you think an effective atrial contraction is necessary for sustaining life? Though the atriums contract towards the end of diastole, it is not an absolute requirement for ventricular filling because most of the ventricular filling happens passively during diastole. Please note that in atrial fibrillation, atrium does not contract effectively, but still people live with atrial fibrillation. On the other hand, effective ventricular contraction is a must to pump the blood into the circulation, and therefore a perfusible rhythm must be present. Please note, ventricular fibrillation is not a perfusible rhythm. This diagram illustrates the three most important electrical activities noted during the cardiac cycle, namely natural pacemaker, AV nodal conduction to the ventricles, and ventricular contraction. The atrial impulses should be spaced enough to have adequate time or diastole for ventricular filling to maintain the end diastolic volume, enough stroke volume, and cardiac output. Please note, the end diastolic volume refers to the volume of the blood in the ventricles at the end of the diastole. Is also called preload. This is very important because of the force of contraction of the ventricle is directly proportional to the stretch or the initial length of the muscle, known as Frank-Starling law. Stroke volume is the amount of blood pumped out of the left ventricle during systole. Cardiac output is the amount of blood pumped out of the left ventricle in 1 minute. Technically, it is heart rate multiplied by stroke volume. So, the end result is perfusible rhythm with an acceptable cardiac output. Before going into the electrocardiogram tracing of atrial activities, few points. Normal heart rate is defined as rate between 60 and 100 per minute. That means heart rate 59 is bradycardia, but 60 is normal. Heart rate 100 is normal, but 101 is called tachycardia. Using the term ventricular rate versus ventricular response. When the ventricle contracts regularly, the term rate is used. When the ventricle contracts irregularly, like seen in atrial fibrillation, then we call it slow or normal or rapid ventricular response based on the number of QRS complexes per minute. And the last one here is the term junctional rhythm. The junctional rhythm is another name for AV nodal rhythm. The electrocardiogram paper runs at 25 millimeters per second as written here. The 5 large squares runs in 1 second. If a beat falls 5 large squares apart, that means every second 1 beat, 60 beats per minute. Let us look at the issues with sinus node activities and resultant P waves. I am going to draw only the P waves and ignore the QRS complexes. Please imagine that the QRS complexes are following all the P waves. First of all, if the electrode is not connected, it will give a flat line. This can also be seen in asystole. The SA node can function normally. For example, with a heart rate of 60 per minute, or it can just discharge the impulses up to 100 beats per minute, which is also normal sinus rhythm, or it can discharge the impulses very slowly or slower than 60, which is called sinus bradycardia, or it can discharge the beats a little faster at 150 beats per minute. As every 2 large squares is 150 per minute is sinus tachycardia, or it can have a normal morphology of P wave in just varying intervals, which is sinus arrhythmia. The sinus node can stop firing the electrical activity, and there may be a flat line for a prolonged period, which is called sinus arrest. On the other hand, this may be transient, and the SA node can stop firing and resume firing. If this is a short interval, say 1 to 2 seconds, it is called sinus pause.